Please allow me to stand on the protocol that has already been observed. But foremost, allow me to recognize our Minister, Ramaotwana. Sir, thank you very much for joining us today. Ladies and gentlemen, it's my dignified honor on behalf of Botswana Development Corporation to welcome you here today to witness this dignified ceremony of welcoming the essential medical supply that we have all been waiting for this past few weeks. Ladies and gentlemen, today is not only about receiving this consignment of essential medical supplies, it is really a testament of what is possible when vision, leadership and partnership converge together for a single national priority, being the wealth, being and healthcare of our citizens. Ladies and gentlemen, my role today is simply to welcome you to this event, but allow me to send my heartfelt appreciation to the leadership of this country, our government, for seeing it through that our citizens deserve to be prioritized above the efforts of capitalism. Ladies and gentlemen, allow me to bring it into perspective. I have been seeing the questions around what is actually the cost of this consignment. So in the spirit of transparency, I would like to break it down for you in granular terms. So this consignment that you see here today, landed cost, the cost of medical supplies, the cost of this airplane, and the cost of moving it today from here to delivery of the distribution center to our people has costed us $3.2 million. This amounts to about 43 million pula in today's exchange rate. What is that? A couple of weeks ago, we, as the National Task Force, went into the market to look for quotations for 6 months worth of supply of essential medication. The quotation that we received was north of 800 million pula. What we brought here today is 3 months of supplies so that we can manage the expiries and be able to manage the cost and spread it across different aggregators across the world. So this 3 months worth of supply that costed us 43 million pula would have originally costed our government over 400 million pula. We've managed to procure this essential medical supplies at only 10.91% of what will normally cost our government. So I say to our suppliers, our participant in the healthcare industry in Botswana, to say, we are not cutting you off. But in the words of our recently departed brother, ATI, Muto change. Change. This is not about you, it's about all of us. He used to say, it's not about me, it's not about you, it's about the people. Ladies and gentlemen, in my words of appreciation beyond our government, I would like to send our appreciation to the Ministry of Health for facilitating us and working with us to see through that our people are provided the essential supplies that they need. We will continue to work with you and work with all our medical participants in Botswana. Like I said, we are not looking to cut you off, but we are really showing you that we can also take decisive actions to make sure that our people are given a decent livelihood. I would like to also extend my heartfelt appreciations to the Unity Healthcare team for your tireless work and support to make sure that the logistics of bringing this through today have went smoothly. I would like to also recognize the BDC staff here today and those that have not joined us today to say thank you very much. Your efforts have not gone unnoticed. So ladies and gentlemen, I would like to welcome you all to this event today to not only celebrate this consignment here, but to ignite the hope and to also say to our citizens that leadership is fully behind you. We will decisively provide essential services to our people. So ladies and gentlemen, la mogelesegile, and please feel free to spend the next couple of hours as we unload this consignment in the spirit of transparency and hope for our people. Thank you.
Tisi, your words of encouragement, more especially those anchored on 1 Corinthians, where it says we have to abide by three things: hope, faith, and love. So you have encouraged us to have hope, to have faith, above all, to trust in God with love. We thank you very much with that prayer. The Managing Director of BDC, Ramaotwana, thank you very much for also assuring our private partners, private companies, private suppliers that it is by no means the intention of government to cut anyone out. We really need a strong, vibrant private sector. We will engage you. We will involve you. We will ensure that you participate in the process. It is only that we are operating under the state of health emergency. And in terms of the law, once there is a state of emergency, it means you are saying, I want to do things within the speed of a light. Suspending all normal processes. That is the essence of the Constitution when you embark on state of emergency. It's like going to court on urgency. When you go to court on urgency, you are saying, please judge, suspend all the rules of the High Court. This matter is urgent. I want the order now, the rule I say now, because if you don't, there will be dire consequences. So we are also in that state of affairs where we have said there were no medication in our shelves, people were suffering, and then the president has to intervene by way of invoking the Constitution to help the necessary processes. So that, as he has committed, it will pass and go to the normal processes. Thank you, Managing Director. Permanent Secretary in the Ministry of Health, Professor Nkomazana. Permanent Secretary in Trade and Entrepreneurship, Joel Ramapoi. We recognize you also that you have been part of this war in order to ensure that we save life. Thank you very much for that endurance. Also, representative of the commander of the BDF here present and your team, we recognize you. We also recognize Her Worship, the Mayor, Mayor Sikiti, who is present with us. When I spoke with the Mayor last night, he was somewhere in Tatisiding, and then he delegated here to come and witness this process. Together with your colleague, specially elected Councillor Medokas Ubuetri, we also recognize members present from BDC, members present from the Ministry of Health, members present from the Ministry of Trade and Entrepreneurship, also recognize members of the police services, recognized media here present, also recognize everyone. Ladies and gentlemen, a very good morning to you all. Today we are not just welcoming a consignment of medicines, we are affirming a solemn premise that the health of Botswana remains at the heart of our national development agenda. I have witnessed firsthand the pain that medicine shortages brings to the families, the uncertainties for patients living with chronic conditions, the anxiety of parents with sick children, and the immense pressure placed on our healthcare professionals. This is why today's milestone is so deeply significant. The consignment we receive today, facilitated through the Unity Healthcare Fund, together with Botswana Partnership, is not only about filling our shelves in hospitals and clinics. It is about restoring confidence, saving lives, and sending a clear message that Botswana will not compromise on the health of its people. Our national health priorities remain clear and firmly anchored in Vision 2036 and the Sustainable Development Goals, namely universal access to essential medicines and vaccines, ensuring that every Motswana, whether in Gaborone or far-flung areas, can access the care they need. Strengthening primary health care, building resilience clinics, and community-based health systems that form the first line of care. Combating non-communicable diseases or NCDs, such as diabetes, hypertension, cancers, which are on the rise as we speak. Also investing in material and child health, because no mother should lose her life while giving life, and no child should be denied a healthy start. And preparing for public health emergencies, drawing lessons from the COVID-19 pandemic, and ensuring we can respond faster and stronger in the future. Promoting innovation and digital health, harnessing technology to improve efficiency, access, and accountability in our health system. This partnership directly advances these priorities mentioned above by securing 85 life-saving medicines and essential supplies. We are addressing immediate gaps today while laying the foundation for sustainable procurement system tomorrow. I guess the 85 should read 82, if what we got that side is correct. So what does this mean for Botswana? It means our hospitals will not have to delay treatments. It means our health workers can prescribe with confidence. It means families will not be forced into unnecessary hardships due to shortages of medicine. And it also means we are firmly on the path toward achieving SDG 3 goals, which is good health, and well-being. But let me be clear, today's achievement is not the end. It is the beginning of a new standard, a standard where private agency, innovation and collaboration define how we respond to the needs of our people. It is also a reminder that health is the bedrock of our national prosperity. Without health, there's no education, no productivity in the workplace, and no sustainable development, hence leading to the collapse of the economy. There will be a lot of sick leaves, there will be a lot of people hospitalized, and there will be no productivity and the economy will suffer. So with medication, then we'll have stronger workforce and the economy will also grow, and teachers will be in class to teach, and students will also go to school after being given medication. Please allow me to commend Botswana Development Corporation and the Unity Healthcare Fund for their foresight in stepping into this space. Their work is proof that when the private sector and government act together, the results are powerful and life-changing. As government, we reaffirm our commitment to ensuring that these medicines are distributed swiftly, fairly, and transparently to all facilities that need them most. We will continue to strengthen partnerships that put the well-being of Botswana at the center of our operations. So this is not simply the arrival of a cargo, this is the arrival of renewed hope, restored trust, and reinforced determination to build a healthcare system worth of our people. And jaka murutana bua are ne le tshuluhelo, jaka re Jobe ane le tshuluhelo mo modimo wa gagwe. O irileng Jobe a thasetswe ke bolwetse a tswa dintho mmele otlhe, dithuto tsa gagwe, dikgomo tsa gagwe, letsomane la gagwe le swa lothe, Satana motsa roka e modimo wa gagwe go togetse. Bona gore gompieko yana dio tsa go khuma go enyeletse yotlhe, o mohumanegi o dintho ka e modimo wa gagwe gore lona le modimo o hodisang ke o sa go hodise. Jobe a ska la thegela ke tshepo mabakeng a thata a bolwetse jana le mo go jone e ditiko ya modimo gore a mme o na le tsholohelo mo modimong, a mme o le rato mo modimong, a mme o na le tumelo mo modimong. Jobe a supa tumelo a re nya modimo wa mo teng o tla mphodisa e bile o tla busa tsotlhe tse di lathegileng. Ke ene thero ya modimo a re nne le tumelo, a re nne le tsholohelo. Batswana bethu goromente ha na go le lata, goromente wa itse ka mathata a lona, goromente o le ka bojothe. Tautona Advocate Boko le tona Modise le ba lephata la botsogo permanent secretary ba le ka sengwe le sengwe gore melemo e nne teng botsogo ja lona bo tokagale. Goromente ke ka ntlha ya kgotho ya madi, mme re tla leka gore Batswana ba bone melemo go ithella melemo e nna mentsintsi, mme re lebogela bao ba batisitse melemo go boloka botshelo. Ka lekalo ke a leboga ka re pula.
Tsholofelo. Tsholofelo. Mo bongakeng ja rona re ta fola.
Our lives are in good hands. But also, our level of good as le ba le patalote ba na le bone. I'm very so happy. Ramaotwana o ile ke setse. Or ha ke ka re mo. Maybe that happen. Re tletse ke setse.